And welcome back to 23 ABC News special coverage of coronavirus Q&A. Tonight, we are taking your questions on our Facebook live stream. You can go there right now and submit a question, and we will ask it for you. We had local doctors in-house just a moment ago talking about the coronavirus and what they know up to this point. And remember, this is still very much in the infancy stage as they continue to learn more and more about this as the days go on. But now we're talking about the facilities in our community that are set up to help you should you need it. And we are joined by several executives. Thank you all for coming in tonight. Beginning on my immediate left, Ken Keller, who is the president and CEO of Bakersfield Memorial Hospital. Ken, thank you for coming in. Next to Ken, Amandeep Basra, CEO of Good Samaritan Hospital. Thank you for coming. Down in front, we have Charlotte Briggs, president of Adventist Health, and David Womack, senior vice president of Kaiser Permanente. Thank you all for coming in this evening. David, why don't you start, because as you were listening to the first half of the show, we were asking a question regarding trials, and you had information on that.
Yes, actually I'm very pleased to say that we have a health research institute in Washington State, and on March 3rd they administered their first vaccine that's the first as a human trial for the COVID-19. So unfortunately, vaccines take a while to go through the trial process and get approved. So we're probably looking at 12 to 13 months out right now, but there is a vaccine on the way.
Now, we've heard a little bit about that, and I believe we reported on that specific case already. Was the trial person, someone who had it? Is that how that works? Can you describe a little bit of that?
No, it is, people will be given the vaccine, and of course there's a control group, and then they're traced through the process as they go. So.
Oh, okay. All right, first let's begin just with the various facilities. And Ken, I think I'd like to start with you. When it comes to the protocols for dealing with any patients that would come into your facility who would be deemed as highly contagious, before COVID-19, what did you have in place to sort of deal with that type of patient?
Well, every hospital, as we present or as a patient presents, if there's the theory or the thought based upon the clinical diagnosis that they are at risk for an infectious issue, COVID-19, flu, or whatever it might be, we have protocols to separate, segregate, and eventually isolate, if necessary, that patient to protect themselves, to protect the healthcare workers, as well as to protect the other patients that they might come in contact with.
And what about a Good Samaritan?
It's the exact same. We all follow the same guidelines. We have our infection control team. They monitor all that.
Is there anything in particular that may have changed since COVID-19 came into the picture? Have you added anything to that?
I don't know that we've added anything to it. I think that there's just a heightened awareness of it. We're getting more people in because of the concern. So we're just implementing our procedures. This is what we do. I mean, for us, this is, as in all hospitals, this is just what we do.
And because of the particular fear around COVID-19 and some of the unknowns at this point, most of us, including Kaiser Permanente, we now have screening at our front doors. We're limiting the amount of access to our buildings, so there's only one entrance. People are screened there, and if they screen positive, they're immediately isolated. They're not going through the normal check-in process and those sorts of things. We're also asking our members, we're reaching out to them via phone calls, emails, and texts to, if they're having symptoms, to not even come to us, but to call us. And then we're screening them either with a telephone appointment or a video appointment. And then if they test positive, then we're directing them to very specific locations so they do not interact with other people. And tomorrow we will have a drive-through testing facility up and operational, so people will come through, never even get out of their cars, will collect the specimen, and they'll be on their way.
Did you want to add to that? Can I notice?
I was just going to augment what Dave is saying is, to our point, all of the hospitals are basically big boxes, right? So when patients come, we don't necessarily have a way to fairly quickly diffuse them if we identify them while they're in the hospital or while they're in the emergency room or while they're in one of our waiting rooms.
Okay.
So given the opportunity, as Dave and Charlotte mentioned, we're now greeting the patients even before they get into the hospital, and if we identify a patient or a visitor at risk, we take the appropriate means to, again, separate them to the point. if we're able to do additional things through, whether it's drive-throughs, whether it's through walk-up clinics, whether it's through other opportunities to sequester the patients that may be at risk for COVID-19 or other serious issues like that, we have the ability to do that now before they get into the hospital and then start to affect and infect potential other patients and teammates.
Yeah, I think that's an important thing, Ken, to say, because I think when people come up to our facilities and now they're seeing tents outside, I think there's two things that are coming up. So people want to bring somebody with them. And as we're looking at how do we keep our healthcare workers safe, how do we keep the other patients safe, we're really limiting additional people who come into the facility as we're really trying to help bend this curve. I keep saying this isn't a hospital issue, it's a public issue. And as hospitals, we're there for you, and our responsibility is to keep you safe. So some of those measures you'll see now, tents in front, all these things of drive-through, are all meant to keep you safe. So I just keep saying for people who come in and want to be there with their other loved ones, we're trying to keep you safe as well as your loved ones safe.
So come in. Mandy, what about patients that don't have primary care physicians? So the only option they have is coming to that facility. As far as there are protocols as far as treating those patients in different areas with the doctors on staff?
So we try to do, because we don't have emergency room, so we get patient direct admits. So we try to talk to all the primary cares, try to talk to them, educate. We actually have a task force. We send that task force to educate our referral, like all the doctor clinics, how to educate them, how to educate their staff so their staff is safe. So how they can actually screen, what they need to do. Even people calling, call the emergency room, because we want to make sure our employees are safe. So our goal is that we don't want to at the point where actually our own people are get infected and then we are struggling with our labor pool. So we are trying to protect them too. So it's a big piece is education. We try to education our staff, our referral sources, all the primary care clinics. If any urgent care, I try to talk to them personally. You guys need any assistance on education? You guys need any help with the screening forms? So we try to do those things because it's a community thing. So that's what we implemented.
They talked about today, Matt Constantine during his press conference said there were 84 notifications from healthcare providers. I know that due to medical laws you can't get too specific, but have all of you seen a case that's been referred to county health that's being monitored right now?
So if your question is all of us have tested people?
Tested people, yes.
Yeah, so I would say probably yes.
Yes.
Right.
Absolutely.
Yeah. So
I was looking for a number, but that's okay. Whether it's dozens, because I mean, that's I think one of the big scare things for a lot of people is that all the talk that's been going on nationally, every time the president or one of his physicians gets up before it, it's talking about the spread and how massive it is and whatnot. And I think a lot of people that contact us, they're just curious, are we talking hundreds or are we talking thousands of potential people?
So maybe I can give you a little bit of a ratio.
Okay.
We have 113,000 Kaiser Permanente members in Kern County.
Okay.
We've tested less than 2 dozen, and we have 4 under investigation waiting for the test to come back right now.
Okay.
So that gives you a little bit of a feel.
Well, and I keep coming back to, when you're listening to the experts and, the statistics and the information, take the messages that they're giving you as well. And that comes back down to use some common sense on the information that's being presented. Stop shaking hands, make sure you're washing your hands, make sure that you have some distance between, make sure that if you feel something going on, you don't go out in the community at large and attend large events and things along those lines. The second one comes back to what Dave is saying with statistics of the frequency is, we've been talking about this since we started hearing. It's a question of when. It's not a question of if. We know we're going to have patients here. We don't know exactly how many there will be, but what we all have been doing is stepping up and gearing up to be able to take care of the patients as they come through. And as Charlotte's mentioned, going extra steps to add capability, capacity, and resources so that when it does happen, we're ready to hear for the community at large.
Are any of you go ahead, I'm sorry, Charlotte.
I just think we're very fortunate to have a public health department that's so active. And if we can say we're very fortunate to have other countries who've already gone through this, right?
So you've already seen China go through this, you've already seen what happened in Italy and that
South
sort
Korea,
of thing.
right?
South Korea.
So we have learnings from that. And I think, once again, I just want to say our politicians, whether it's Senator Grove, Vince Fong, Mayor Go, they're all there for us. And Matt's done a great job with the public health. And I think if there's one thing that I would ask the public, because I get calls all the time. In fact, I text my colleagues at the other hospitals and say, rumor has it this, right? And so
you see all the rumors as well.
Oh my gosh!
Yes.
And so, but I think we're all committed. We talked earlier. Our CMOs are all working together. We work together as hospitals because we're here for our community. If there's one request I would say is that the rumors that are going around, check with public health. They'll tell you what's, Matt's given a great job of giving overviews and stuff like that. And quit with the toilet paper thing.
We're going to get to that later. No, but since you brought it up, let's talk about that rumor, because so often, and we've obviously, we get a lot of that sent to us, saying, have you seen this? Is it true? That's the favorite phrase right now. Have you seen this? Is it true? And many of them circle around one person, two people, three are at this facility currently being treated for coronavirus, where, David, you just mentioned 4 out of the 12. Maybe what they meant was they were there being tested. Not necessarily treated.
Well, could be, but
because if someone did have COVID-19, Matt Constantine would tell us.
Absolutely, just like he did yesterday.
But you got to remember, somebody is in a facility being treated for COVID-19. So they're in the facility because they have a health issue.
Right.
Either they have COVID-19 or they have something that looks like it, whether it's pneumonia, whether it's a deep pulmonary issue or something along those lines. Yes, they're being treated, and by our game plan, we assume and we treat as if COVID-19 is present until it's not.
Okay.
And when it's not is when we get those results, and that's where you come back to the 4 out of 4 being tested, but we don't have the results yet. And so from a I'll say a care provision standpoint, that's what our physicians, that's what our care providers have to do.
Amanda?
So we try to educate our staff, because the nurses and all the staff we have in hospitals, they have a family member, they are panicked. So we try to, if you have a question, call the public health department. We have a CMO, we have our staff who can educate you, because it's like one person just start and it's like, there is I get a call, like text message, the San Joaquin have, you guys have. It's like, it's a frustrating, because same time we are here for a community, we are at the front line, we will do whatever we need to be. Our doctors are, this community is very lucky, it's very supportive. Everybody is at the support. Mayor, we get to support what we need. But it's a time when people get panicked. It's like everybody's responsibility to educate your family. Even healthcare providers who are working in hospitals, end of the day, they ask the question, is it true? Because they want to know under HIPAA, they cannot. So they are going. So I think it's everybody's responsibility to just stay calm and help us. And same time, if you don't need to see the doctor, you don't go 3 people with the grandma. So we try to, I was talking to, if they need, let's see who can help you. So even we are trying to do that on our side. It's like, I was talking to one of the urgent cares, like, can you just see those patients who don't have these kind of symptoms, but they just have a mind, like headaches, or they need to be seen. So can we do something like that? So it's like we can protect them. So I think it's everybody's responsibility. All of us need together. We need a community to support us.
And you obviously all understand the fear going around with all the unknowns regarding our community. Let me ask you this, as far as the city and county's response locally, just dealing with this locally, and I'm going to have each one of you, David, you can start. What's the response been like, and how do you rate it to this point?
So I would rate the County Public Health Department 10 out of 10. I mean, they are on top of it. They're communicating well. They're supporting those of us assessing the patients out in the field. Absolutely no complaints. Great job.
Charlotte, does more need to be done by the city or anyone as far as, I mean, different areas of the state? They're sheltering in place, 7 million people up north in the San Francisco area.
Yeah, so I think that that's really where our city has come together and said there's some closures that need to happen. Our governor has said that these are some closures that need to happen. And I think that that's important because really, as we're really trying to do is bend that curve. Right, so the slower we can roll this out, and it may continue rolling out for people, but the slower we can do it, the less impact it's going to have on our community, which I think is extremely important.
I think we have really good support from Department of Public Health. So they are very supportive, and even the city, and even our whole team, all the hospitals working together very well.
Ken, any further steps that you see coming down the road here?
Oh, there's always going to be more steps because we'll know more tomorrow than what we know today. And we'll react to it, we'll adapt and make sure that we're there to take care of what we need to do for our patients and for the community. But to your point and to your question, I'll come back to 3 things that these guys, the county, the city, the state as well, communication. There's been a tremendous amount of information coming to us that we're able to diffuse to our staff, to our teammates, and to the community at large. Second is the offers of support. What do you need? What can we do for you? What can I do to help? And then third is that the support from the other side. We're here for you. We're praying for you. We're here if you need us. And so those things help us out as we do what we do, and that's what our teammates do.
All right, very good. We're going to take a quick break right now and come back with some final thoughts. You are watching 23 ABC News special coverage, the coronavirus Q&A. We'll be right back. And welcome back to 23 ABC's coverage of coronavirus. This is the Q&A. We want to thank you for being here this evening. And just finishing up with some final thoughts, let's go ahead and, if we can, jump into this other question that we received from James, I believe it's Feemster Jr. He had asked, and obviously population aside, Wondering if Bakersfield's going the way of San Francisco as far as lockdown and the severity of things that are going on up there that they're having to deal with right now. The 7 million people ordered to shelter in place, Ken?
Well, those orders would come from the county government. And if they deem so, we'll be ready to support and be there as needed. At the end of the day, it's going to be a question and decision, I believe, really on the density of the population. San Francisco has a lot more people compacted in a much smaller space than we at Bakersfield do.
If we could, Charlotte, just when preparing to deal with something like this on a mass scale, local facilities prepared to deal with potentially 100 or more people out there if they were to test positive?
Yeah, I think we all have incident command centers we've set up, and these have been set up for actually weeks in place. And so as we look at the beds available within Kern County, we'll take care of our people. We're committed to take care of our people.
David?
So, yeah, I agree with Charlotte and Ken. We're there.
Mandy?
Yeah, it's the same team. We work together very closely with each other.
Speaking of your teams, have any of you expanded on your team members? Have you had to call in extra people in preparation for this?
We haven't pulled in wholesale new people to our team, but what we've been doing is, I'll say, redistributing and reallocating based upon what's going on any given day.
Okay, what like different areas would that require?
Well, as Charlotte mentioned a couple moments ago, if we need to adapt and reduce the number of surgeries that we're doing because we have more COVID patients coming in, then what we would do is use those resources within the surgical theaters, within the prep rooms and so forth, and nurses that were doing surgery may be bedside nurses in the future state. Those are some of the types of conversations that we have in these incident command centers as we're planning for what's the next thing going to be.
Anything in particular that really stands out when it comes to this, when it comes to separating people and keeping them, as opposed to within your facilities?
I think once again is when respiratory patients come in, we're making sure that they're separated. And I think this is just what we do, right? So I think there's all kinds of rumors out there. There's rumors that we don't treat at different hospitals, we don't treat the people who don't have insurance. We have rules around that. We treat everybody in the emergency room, right? So I think that the community can rest assured that as hospitals, we've got them.
Okay.
And we're here for them. And we don't want them to feel like there's concern about beds or anything like that. We'll help deal with that with our incidents command centers and with each other.
Mm-hmm. And David, how do you expect that to change in the weeks or months to come?
Well, I do think we're going to see a lot more positive cases reported because testing has not been widely available as of yet. We're just now getting to the point where we're going to be able to test a lot of people. So we're going to see the numbers escalate, and people shouldn't necessarily be alarmed by that at all because those cases were probably already there and we just didn't, there was not the ability to test it. We just didn't know. So keep that in mind, keep that in perspective, and do all those precautions that your mama taught you to do.
Let's leave everyone with one final question this evening, if we could, and pop that last one up. And this has been a major concern for many people. Christopher wanted to know, why is everyone freaking out over toilet paper?
I'd like to have
Charlotte?
I'd like to know that. This disease
Not a medical condition?
Yeah,
of some
this
sort?
disease doesn't seem to come from that end. So clearly said, and I'm not even a doctor. So I'm curious. I think probably what it started was somewhere somebody said water and toilet paper, and so we have this rush on toilet paper, and it's amazing to me. So yeah, I say instead of toilet paper, let's pray. Right? Let's pray for our first responders. Let's pray for our hospital people. Let's pray for the people who are stocking our shelves at the grocery store.
Thank you all for coming in. We are out of time. I appreciate it. You can watch the entire segment. It'll be posted to our website, Turner23.com, along with our Facebook page. You can see it there if you want to revisit anything they said this evening. I want to thank you for tuning in to 23 ABC's special broadcast of Coronavirus Q&A. Have a great night.